Next is Demerol. Demerol pethidine, also known as meperidine and sold under the brand name Demerol, among others. It is a synthetic opioid pain medication of the phenylpiperidine class. So, Demerol is a highly potent opiate with growing rates of addiction. While a prescription of Demerol is legal, it is rarely prescribed outside of intensive hospital care. It has similar effects of other opiates like morphine, putting users in a dreamlike state when abused. Next, Dilaudid. So what is Dilaudid? As one of the more powerful opiates, Dilaudid is mainly prescribed to patients diagnosed with cancer or serious injuries. It is abused for its intense calming and euphoric effects. However, Dilaudid comes with a high risk of overdose which can be fatal. Next, fentanyl. So what is fentanyl? It's known to be up to 100 times stronger than morphine and is used primarily to treat pain after surgery. Recreational use of fentanyl is especially dangerous when combined with other opiates or heroin. Fentanyl causes the respiratory system to slow down, leading to overdose and potentially even death. Next, hydrocodone. What is hydrocodone? It's commonly prescribed for pain relief following oral surgery. However, taking this opiate without a prescription is legal and constitutes abuse. Abusing hydrocodone over an extended period of time or in large amounts can evolve into an addiction. Next, methadone. What is methadone? It's widely known for its common use of treating a heroin use disorder. Despite its intended legal use, methadone is still an extremely potent opiate with highly addictive qualities. Methadone should only be taken under the careful supervision of a physician. The next is morphine. Morphine is primarily prescribed to hospital patients recovering from surgery or diagnosed with cancer. A person suffering from an addiction to morphine may compulsively seek out and abuse the substance despite legal ramifications. The next, oxycodone. Oxycodone is a powerful painkiller and one of the most abused prescription medications in the United States. Many people unwillingly kickstart an addiction by taking their regularly prescribed dose. Once a tolerance is established, using or obtaining oxycodone may be prioritized over personal obligations and social activities. So next is propoxyphene, otherwise known as Darvon or Darvocet, was once prescribed for moderate pain relief. And users who abuse propoxyphene experience a rush of euphoria followed by heavy sedation. Next is tramadol. is used to treat moderate pain for medical conditions such as fibromyalgia. It is also perceived to be less addictive than other opiates and is therefore commonly prescribed by doctors. As with any other opiate prescription, the risk of addiction is still at large. So for the fifth common types of drugs, we have sleeping pills. So what is sleeping pills? Hypnotic or soporific drugs, commonly known as sleeping pills, are a class of psychoactive drugs whose primary function is to induce sleep and for the treatment of insomnia or for surgical anesthesia. Types of sleeping pills. First would be zolpidem, sold under the brand name Ambien. Among others is a medication primarily used for the short-term treatment of sleeping problems. Ambien is generally prescribed for short-term insomnia. Most cases of Ambien dependence start with a person takes more than the recommended dosage to fall asleep faster. An addiction to Ambien can form in as little as a few weeks. The next is amitalsodium is a type of barbiturate. The brand name for amobarital. Doctors prescribe the medication as a sedative, an anti-anxiety medication, or a pre-anesthetic before surgery. Amital is used as a pre-anesthetic for surgeries and to treat chronic sleep disorders. It produces effects that feel similar to alcohol intoxication, which causes users to abuse the medication and subsequently become addicted. Next, Lunesta or isgopiclone, sold under the brand name Lunesta. Among others is a medication used in the treatment of insomnia. Next, zaleplone, sold under the brand names Sonata. Among others is a sedative hypnotic used to treat insomnia again. Then last is stimulants. So what is stimulants? Stimulants is an overarching term that covers many drugs, including those that increase activity of the central nervous system and the body, drugs that are pleasurable and invigorating, or drugs that have sympathomimetic effects. So types of stimulants. First is Adderall. So Adderall is the most commonly prescribed stimulant for treating symptoms of ADHD. People who habitually use Adderall to increase their productivity and improve their mental focus have the highest risk of becoming addicted. So next is Antidepressants are medications used to treat major depressive disorder, some anxiety disorders, some chronic pain conditions, and to help manage some addictions. Next is Concerta. It's a stimulant medication used to treat attention deficit hyperactivity disorder and narcolepsy. Concerta is a prescription stimulant similar to cocaine. People who develop a dependence on Concerta will feel strong compulsions to seek out the drug in any way they can. Individuals who cannot obtain more of a drug may experience withdrawal symptoms, which are sometimes referred to as the concerted crash. Next, Dexedrine. Dextroamphetamine is a central nervous system stimulant and an amphetamine enantiomer that is prescribed for the treatment of attention deficit hyperactivity disorders and narcolepsy. Dexedrine or dextroamphetamine is an amphetamine with a high potential for abuse and addiction. After repeated use of Dexedrine, the brain cannot function normally without the drug. Side effects of Dexedrine include insomnia, blurred vision, and dizziness. Diet pills. Diet pills include a number of over-the-counter and prescription supplements designed to help users lose weight. Aside from their appetite suppressant effects, diet pills can cause elevated energy levels and feelings of euphoria, which increase the likelihood of abuse and dependency. Next is Ritalin. It's a stimulant medication used to treat attention deficit hyperactivity disorder and narcolepsy. As a central nervous system stimulant, Ritalin increases alertness and concentration. Next is anabolic steroids, or synthetic substances that mimic the male hormone testosterone. They are commonly abused by people wanting to increase athletic performance. While they don't produce the same euphoric high as other addictive substances, frequent use of anabolic steroids can lead to an addiction.